Dr. Manuel Friese is a clinician-scientist at the Institute of Neuroimmunology and Multiple Sclerosis at the University Medical Center Hamburg-Eppendorf in Hamburg, Germany, where he serves as the director of the Center for Molecular and Neurobiology, director of the Institute of Neuroimmunology and Multiple Sclerosis, a professor of neuroimmunology, and a consulting neurologist at the University Medical Center Hamburg-Eppendorf. Dr. Friese is also this year's recipient of the Barancik Prize for Innovation in Multiple Sclerosis Research in recognition of his pioneering work in uncovering how inflammation links to nerve cell death in MS and how this interaction actually drives disease progression. Welcome and congratulations, Dr. Friese.
Thank you very much.
You have famously said that nerve cells aren't just passive victims of the immune system. For someone living with MS, what does it mean to change the focus from stopping the attacker, the immune system, to fortifying the house, protecting that nerve cell?
Yeah, so one of the key really elements in my research is that we try to readjust our understanding of how MS is progressing. And then I think that progression of MS is still the most unmet clinical need in MS, and that is where we need to understand how that comes about. And the focus so far has been looking at the immune system, trying to modulate that. But we think that we might come too late in doing that, because when the diagnosis has been established, maybe everything has already been adjusted in the house. And therefore, we try to understand what has been adjusted in the house, in the brain, in the spinal cord, to maybe readjust it. And this adjustment is mostly done properly in the nerve cells themselves. It's not so much that certainly the immune cells are still there, but the neurons, the nerve cells, they respond to it. And this response we want to understand.
Much of your work addresses the slow progression that happens even when there are no new relapses. How does your research into neuronal stress help us understand why some people still get worse even when their MRIs look stable?
That is exactly the point we want to understand, is that we think that neurons or nerve cells are putting on a track. And this track probably has been defined very early on. So they have seen the inflammation, and the inflammation has done something to the nerve cells. And they probably have a response, a memory for the inflammation. And this is somehow what is determining their further outcome. And this outcome, first of all, we want to understand how these nerve cells are responding, and then to maybe readjust and trying to put them back on where they were in the beginning. And that could maybe stop in that they eventually die, these nerve cells. And it's probably in comparison to other primary neurodegenerative diseases, where we also see that in Alzheimer's disease and Parkinson's disease, the nerve cells themselves somehow respond to something. It could be different stressors. In MS, we have the stressor of inflammation. In other diseases, we might have other stressors like protein aggregates or protein misfolding of proteins. But the nerve cells probably respond to it in different fashions, and then they are putting on a track, and we want to understand this track, what determines then their long-term outcome.
You've identified that inflammation forces neurons to shut down their energy production. Is there a way we can reboot the energy centers of a nerve cell to keep it from dying?
Yeah, so that's one of the key questions, I think, in many neurodegenerative diseases, that in the end, the neurons try to modulate their energy. And one needs to take a step back and try to understand, why do we have this inflammation in the central nervous system? It is probably not because evolution has primed us to actually get MS. But evolution has primed us to be really resilient and resistant to infections. And somehow this is has been gone into disarray, and now we have upholding this inflammation. but the brain, the nerve cells still think that there is an infection around. That's why we have inflammation. And they try to respond to something which they think there's an ongoing infection. At least that is what I believe, how things are happening. And one way to really modulate infections is to shut down energy, not to give pathogens a lot of energy, because the pathogens should not kind of unfold themselves. And we still see that, I mean, if we have a very dramatic flu, we don't eat. We try to really not take up any energy to fuel the pathogen. And that, I believe, is something which is at the core of our problem. And now the question is, how does that actually on a molecular level happen? And these switches and key elements at hubs we try to understand to then give the neuron kind of or lift the brake to then again consume energy and to then thrive again.
You mentioned when we have a flu, for instance, we don't eat. I'm curious, does your research suggest that certain dietary nutrients might actually provide the raw materials neurons need to maintain energy and resist stress?
I believe, there is always the hope that you can just readjust your food, your nutrition, and then you can somehow modulate the outcome of MS. Certainly there's components to it, which might be absolutely true. We have not entirely understood what the components are. But I think at the moment, the picture which unfolds is more the contrary, is that neurons consume too little energy, actually, because they are primed not to consume too much, right? Because inflammation is around and they should somehow modulate their energy uptake. So we just need to give the neuron, the nerve cell, a stimulus that they should actually, again, take all the energy up which they are getting provided. Having said that, one of the major caveats we think is that because they change the energy and because there's inflammation around, a lot of reactive oxygen species are getting produced. And that certainly damage also the neurons because they are doing a different kind of energy production and inflammation is around. And having an idea of how to modulate these reactive oxygen species, I think, could be something which could also be then positively modulated by the nutrition. However, it's very early days. People look into that, how to actually scavenge the reactive oxygen species and how to somehow give really good nutrients, which are then also passing to the to the brain, to the spinal cord. But these are early days. And if I just give you one example, vitamin E is one of those. But vitamin E is plentiful in the brain. So if you just give more vitamin E, there will not be more vitamin E in the brain, right? So therefore, this could not be a solution. So we need to find other modes of action and other really drugs probably, which can then reach the central nervous system to an extent that it can modulate this reactive oxygen species.
Speaking of drugs, we have over 20 drugs that target the immune system. How close are we to a drug that targets neuroprotection? And do you think we might be looking at a future where someone living with MS takes one drug to stop relapses and a second neuroprotective drug to keep their brain healthy?
Yeah, so if you look back of how these drugs have been discovered, most of them were either serendipitous finding or they are still not understood why we actually have a modulation of the immune system and what it really does good to the immune system so that it is modulating the relapses. So if you look at how this has been discovered, there's a bit of frustration because the immune system is very complex, and what we give actually drugs which take out a large chunk of immune cells, which we have not understood why that actually is of beneficial effect to the relapses. So even that, so what we do there is very coarse in terms of intervening, and that has somehow some beneficial effect. I believe that the nervous system is even more complex than the immune system. So taking out large chunks or courses of the nervous system is just not possible as it is in the immune system. So therefore, we need to understand first all the delicate balances in the nervous system to really intervene in that. So I think this is even a much larger task than it is in the immune system, because you can live with certain, and you have a very high redundancy in the immune system, and you can live by just taking out a large chunk of the immune system, but it's not possible for the nervous system. So will in the future be two drugs being taken, one really to modulate the immune system and one to the nervous system. I believe that will be the future. However, how close are we to that? I think it will still be quite some time, and that we have really first well understood how the workings are of the nervous system to then really fine-tune the nervous system.
You're both a researcher and a clinician, and a researcher who really lives on the cutting edge of developments. When you're sitting across from a patient in Hamburg and they're worried about their future, how does what you're seeing in the lab change the way you respond to them in the clinic?
Well, first I explain them how MS comes about. So this is just a stochastic event where there are certain things which come together, and some of that already is a relief for the patient, so that there is a very depth understanding of how actually this disease comes about, and there's no fault in having that disease, nothing which has been done wrong by the patient. So that sometimes is already a relief. And it's a very unfortunate event, right? In something which is ingrained in being human, because we have that is our trait of which we have in our humankind, is that we are getting autoimmune diseases as a trait of fighting infections. And if we don't have that, and if we don't have these individuals who develop autoimmune diseases, and this is something which I try to understand, which I try to explain to patients, is that they carry the burden of that everybody lives and can survive against infections, and they carry the burden for humankind, pretty much, right? So this is something which we should also kind of support or heavily support these individuals, because they are living or showing a disease which is kind of giving the other individuals the allowance to really live and cherish without a disease. And that is something which I think is a totally different view on diseases. It's a collective, so it's not individuals. We try to understand diseases as a collection of individuals which are living together. And I think that can already, for some patients, give a relief and a totally different understanding of disease itself.
That is a remarkable perspective. Thank you for sharing with us. Thank you for sharing with all your patients. Thank you for all you do, both in the laboratory and the clinic. Congratulations again on being this year's winner of the Barancik Prize. And thanks so much for spending a few minutes talking with me today.
Thank you so much for having me here.